All right. So today we're going to go over chapter 15. We're going to jump from the beginning of your book back to the very last chapter. Technically, this is the analysis of information with clinical applications, right? So we're going to talk a little bit about the final part of our patient medical dental history questionnaire, but we are also going to talk a lot about HIPAA compliance, right, and maintaining that patient confidentiality that is so important in healthcare settings. So the final questions on our questionnaire, right, are has a physician or previous dentist recommended that you take antibiotics prior to your dental treatment? We will go over those expectations and patients that you may need to follow up on, or some of those recommended pre-med antibiotic dosages for very specific reasons, or if a physician or another healthcare provider has recommended that, then we're going to follow through with those recommendations. We're going to want to know the name. If a patient says yes to a question like that, right, we want to know who their physician or their healthcare provider is and a phone number. That way that we can talk to them. We want to know the intention of the need for that antibiotic, which again, we're going to discuss some of those examples of when that can apply and times when you need to definitely make sure that you're being clear, and you may need the name of a physician even if a patient does not know if they need a pre-med antibiotic. And then, of course, making sure that they understand the recommendations, why we may need to follow up. And sometimes this question can result in previous recommendations being rescinded or taken back based on current guidelines. And again, we're going to go over that more in the semester to come. So we also want to ask our patients if they have any disease, condition, or problem that's not listed above, right? And if a patient says yes, typically they will tell you what that is. If they don't, again, we're going to ask them to tell us more, to please explain, right? And the reasoning for this is that there can be diseases and conditions or problems that may be newer, that may be less common, right? That our questionnaire just cannot contain every possibility that can be out there whenever it comes to health. So it's really important that we listen closely if a patient says yes to this, or if they seem uncertain, then you need to make sure that you are asking them some follow-up questions like, this could be anything, like, let me know anything you think that we haven't talked about, right? Because it could affect our plan on our procedures moving forward, things that we're going to do. And then, of course, it could be we may need to address effects of medications that are associated with newly reported conditions, and also medications that we may use or prescriptions that may be prescribed, especially if you are working in a scenario where you're working alongside a dentist that may be prescribing medications to patients. Because as dental hygienists, we don't traditionally prescribe medications of that nature. Now in Colorado, we do have prescriptive authority when you become licensed. If you're in Colorado, a few other states have that too, but Colorado does have prescriptive authority, but it applies really specifically a lot of times to oral health type prescription things, like being able to purchase and prescribe fluoride varnish, being able to purchase and prescribe and administer prescription strength fluoridated toothpaste or chlorhexidine rinses. Also some other periodontally related medications, things you will learn about later, like Arestin, which is a subgingival type of antibiotic. It's very site specific. Our prescriptive authority allows us to be able to do that if you have the right relationship with a working dentist also and the right documentation. You can do those without having to like ask and follow up and make sure it's okay with the dentist. You have that prescriptive authority. Again, that is specific to Colorado. And then, of course, we're going to get those signatures from our client or the legal guardian if we are working on an individual that is under the age of 18. Now, for us in clinic, individuals who are under the age of 18, their parent is going to fill out a child health history, and it also includes that informed consent so that we know, what procedures can and cannot be done for a patient. The only thing that is not included on the informed consent for children or young adults under the age of 18 are things like silver diamine fluoride, that we do require a separate consent form because a more in-depth conversation needs to be had with the legal guardian of an individual. So ways of making sure, right, that information is correct, that things are all looked at and evaluated is by having this paperwork, these forms, whether they're digital or paper, completed by the healthcare provider with the patient, right? It allows us as healthcare providers the analysis of health history information, the clinical management decisions that are based on the health history, and protection against lawsuits to make sure that all those elements are evaluated and discussed with patients. It also helps us, right, verify things, make sure that patients aren't leaving things out, that they haven't forgotten something. A lot of times patients will forget to include something on their health history, but when they are having a conversation with the healthcare provider, that can help eliminate some of that because you have a conversation about it. It also helps eliminate some of those challenges with understanding what a question is on the healthcare questionnaire, whether it's medical or dental related. If a patient is able to talk with you as their healthcare provider, you can answer a lot of questions for them or help explain why things are important, right? And it helps us build a relationship between us and the patient, and also a relationship of information so that we can plan those oral procedures. It makes sure that we don't skip things as healthcare providers either. So anytime that we are dealing with patient information, right, HIPAA applies. All of our patients have the ability to view our Health Insurance Portability and Accountability Act that we have up in the front. They sign a Bill of Rights that states that they have been offered that. A patient can always ask for our copy of our HIPAA kind of protocol and policy in the clinic anytime they would want. That also gives them the ability, if you've noticed at the bottom of our health history form, that a patient they do not have to check the boxes that say, yes, we can share their information. That is very rare in our setting. I have had one patient with a student that did not want to check those boxes. So this patient agreed that their health history was accurate and all the statements were truthful. But they did not even want us to be able to share their information with another dental provider. So we did not check those boxes, and then that student did make sure that they added a flag to the patient's chart. So because that health history is just in the document center, no one would think to check that because it is an anomaly in what most patients are open to and understand the importance of healthcare providers being able to share information between us. Also, ensuring that it's only shared between us, not between other individuals. So HIPAA has been around since 1996. It's getting older and older by the year. 96, it doesn't feel that long to me, but we're getting close to 30 years. So it's getting up there, actually past 30 years. Let's not do the math. Anyways, so it means that we have increased accessibility and affordability of health insurance, right? These are some of the purposes that HIPAA came about. It's the ability to keep insurance after job loss. It ensures privacy of electronically transmitted health information. It gives protection of personal health information, provides the availability of written policies to clients, right? We have that written policy up in the front. And then it really gives safeguards for administrative, physical, and technical levels whenever we are dealing with patient information, right? But HIPAA, we usually think of as the privacy, right, and the protection of our health information, but we often forget about the initial purposes of increased accessibility and affordability of health insurance, and then the ability to keep insurance after job loss, right? That isn't always indefinitely, but there are things in place. So in like Colorado, there's an entity of insurance that's referred to as COBRA. I do not remember the name of the acronym, but that is usually if you've lost your job, kind of an interim health insurance that's intended to get you to that next job position where one would hope and assume that you would have access to health insurance through that job. But HIPAA also gives patients the ability to access their own information. So there are things that are allowed under HIPAA. There are also things that are required. So under HIPAA, you are allowed to call out the client's name to be seated for treatment, right? So you can go to the waiting room, call out your patient's name. You are allowed to have clients sign in. You may see at some offices, they have like the tearaway sign-in sheets so that they do remove clients' names as they sign in. And then you are allowed to place chart markers that are related to safety alerts. An example of that is allergies. Now, this applied a lot more to paper charts in the past, especially because charts sometimes could be visible from the waiting area, especially if you had, a stack of charts, but you couldn't have those full names be easily visible on a chart, on a paper chart. But there were certain alerts or markers that were usually in a sticker form, that looked like a red X if you had a medical alert, or there was a sticker for pre-med, things like that, so that you could designate those quickly by looking at a patient's chart instead of having to flip through it. Now in digital format, we have those as things that pop up or little symbols that change colors on the chart. However, we do need to make sure that clients and patients are not able to see other patients' information, when they walk by or when we are pulling up the appointment book. We need to be aware of those things because we are required to ensure privacy when discussing client treatment in the office. And we are also required to store client dental charts away from public view, right? So that applies to digital charts also. So we do need to be aware of that, right? Especially in our clinic setting, because our charts, our computer screen is visible, which is very helpful. And we utilize it throughout the appointment all the time, but we need to make sure that we are cognizant of client dental chart information being viewed. So when we step away from our computer, or especially when you're in clinic for a whole day and you leave for lunch and you come back, all those windows that you have open with your client's information, your patient's information, need to be minimized so that, someone can't just walk by and be able to see your computer screen. And those are requirements. Right? So we are also required to learn HIPAA requirements, appoint a compliance officer, which that is your instructors in our clinic setting, also receive complaints. We have a method for that with patient surveys. We have office policies on security and privacy protocols. We have written policies for our patients, which are up front. We have a secure client signature to verify receipts of policies. That is our Bill of Rights for patients, which every patient signs one of those. We have employee training. That's what we are doing now. We have discipline protocol for violations. We have that in our handbook. You can receive, warnings or if it is a much more serious issue, that there are different levels within our handbook for the dental hygiene program, right? We are also must prepare privacy agreements with business partners, which we have those, right? If we need access to patients' information, like x-rays is our most common type of transaction of patient information. And then also a lot of times offices will want patients to sign a similar records release type of form before they will send us x-rays or other information. Again, we have that written notice of privacy assurance in public areas. We provide patients or clients the right to access the personal health information. They have the right to identify errors, and they also have the right to request changes, right? So as a patient, you have the right to access your information. You can identify errors and request changes. Now, we're taken to consideration, this was not a requirement. This was not in place prior to 1996. You couldn't always access your own health information, right? It was kind of in some scenarios not considered yours. It was like the hospitals or the doctor's offices, but you have a right to access that information. We want to make sure that we have a self-audit procedure to monitor compliance, which happens for us because of this course, and then also our daybook audits. And then we document training sessions and personnel trained, which easy. It talks about an office preparation for emergency management, and a suggested protocol for that is written emergency plan, basic life support certification, and CPR training. All of us have that. All of you have that. It's a requirement for the program. Periodic office emergency drills. We do that in clinic. And then protocols for unconsciousness, cardiac arrest. We also have an emergency kit and knowledge of how to use it, the ability and knowledge to administer oxygen, and then making sure that we document emergency events in our patient records, right? Which we have talked about this process. And we'll continue to talk about it all semester. So that really wraps up the majority of our conversation that we will have specifically just about Chapter 15. We will also do this week at another time. We are going to go over some HIPAA videos. So there's one in particular that we will watch and identify those errors and mistakes that are being made to help us better identify mistakes and errors that we may be making now and also in the future. I will say one of the most common errors often is discussing patient information in front of other patients. And it can be something as simple as saying, your patient such and such at 1:00 canceled, or do you want to have, schedule this so-and-so patient for this such and such procedure today, right? And we say those things in front of other patients. So it's being cautious and being aware of different scenarios like that. But we will watch together a video and do some kind of memory recall on things that are not done correctly in the video in regards to HIPAA. So that wraps it up for this, and I will see you all in class later this week.